Everyone, welcome back. It's Theresa Callard Moore reading BridgeIT, the Integrative Medicine Approach to the Healthcare Crisis in the United States. If you like what we're doing, please feel free to like our station and subscribe so you can keep up with the book. We're almost done. We're going on to chapter 17 today. I'm having a hard time getting to you on my hamster wheel. All the other countries implemented universal health care plan around the same time in the 19th century. Our hand didn't play out that way, and we used our democratic and commercial development to handle our health care. As we've witnessed with the Affordable Health Care Act, now it feels pretty difficult to change that when we hold on to our core values that got us here, until now. Have you ever considered the difference between health insurance and your car or home insurance? I think I've made one claim on my homeowners after a flood in my house in 20 years. And yeah, they paid for some of the repairs, but I paid much more. I upgraded my home after the event and got a new kitchen. The insurance company doesn't pay my heating bills or electricity or tell me how much natural gas I can use. I make sure every candle is out, every door is locked, every burner is off before I go to bed so that I never have to make another claim or burn my house down. Now let's look at auto insurance. Again, I pay monthly premium in hopes that I'll never have to use it. I make sure I drive carefully, even though I've admitted I do have a lead foot. And even if I get a door ding from someone else, I'll pay for it myself so that I don't use my insurance. The insurance company doesn't pay for my gas, new tires, oil changes, or any other maintenance fees. I do. I was recently involved in an accident. It wasn't my fault. I was rear-ended. And it was covered by my insurance after my deductible was met. Now I hope to never use it again. Let's look at how impossible the expectations are on health insurance companies. They are in the business of collecting a monthly fee for insurance, hoping you'll never need to use it in order to have a successful business, right? The insurance companies realize that there are conditions that lead to expensive claims, like diabetes, heart disease, high cholesterol. In the attempt to prevent these claims, they begin to cover tests and medications to prevent that healthcare crisis in the future. This is equal to my auto insurance covering my gas, new tires, car washes. But even if they did that, they can't prevent my lead foot every morning or if others choose to drive drunk. We choose freedom over self-nurturing, and we choose freedom anytime our doctor or spouse tells us not to expose ourselves to the virus or eat fast food or drink alcohol or smoke. Consequently, the insurance companies can't tell us what to eat, drink, or do either. But they do have to pay for it when we do. And we're angry at them for the high cost of the healthcare premiums. It seems even higher when we've already miscalculated our income based on our gross income instead of our net, as I mentioned before in that chapter with 15 and 16. We as Americans believe that all should be covered because if it's not, it's taking away our financial freedoms to pursue happiness. I'm going to say that again. We as Americans believe that all of our health care should be covered because if it's not, it's taking away our financial freedom to pursue happiness. Basically, we want to have nice things, cars, houses, vacations, right? There's our values conflict. I cannot tell you how many times I hear in my office, if it's not covered by my insurance, I'm not going to do it. Well, if it's not covered by your insurance and it's still healthy for you, why aren't you doing it? I'm going to leave you with that thought. I really hope you like what we're doing here, and please feel free to like our station, subscribe to it, and let's go on to the next chapter because, like I said, I'm really trying to help and shift this idea of what we're doing, but we have to take our health back in our own hands.